I want to thank her and would like to yield some of my time to Congresswoman Kay Granger.
Thank you to my colleague Dan Bourne. Thank you so much for your hard work on this. Mr. Speaker, I rise today to speak on the important issue of colorectal cancer, as Congressman Bourne also did. Colorectal cancer is the third most commonly diagnosed cancer and the second most common cause of cancer deaths in the United States. Every 3.5 minutes, someone is diagnosed with colorectal cancer. Every 9 minutes, someone dies from colorectal cancer. This is a disease that affects both men and women. This year, an estimated 149,000 new cases will be diagnosed, and an estimated 50,000 deaths will be caused by this cancer. The real tragedy is that many of these cancer cases and deaths occur needlessly because the vast majority of colorectal cancer deaths can be prevented through proper screening and early detection. That's why I introduced a resolution recognizing March as Colorectal Cancer Awareness Month and commemorating the 10th anniversary of the first designation of March as Colorectal Cancer Awareness Month. The more we talk about this disease, the more we encourage our family, our friends, and our neighbors to get screened, and the more lives we save. I hope my colleagues on the Energy and Commerce Committee will discharge House Concurrent Resolution 60 from committee soon so that leadership can schedule the resolution for floor consideration. Less than half of those who should be screened for colon cancer are screened. Bringing House Concurrent Resolution 60 to the floor next week will encourage even more discussion about this disease that's preventable when detected early. But talking about colorectal cancer and recognizing Colorectal Cancer Awareness Month aren't enough. We need to increase federal funding for early detection and screening. Along with my colleague from Rhode Island, Patrick Kennedy, I've introduced a bill that would authorize funding for early detection, screenings, and make preventive care a priority. Specifically, the Colorectal Cancer Prevention, Early Detection, and Treatment Act, H.R. 1189, would establish a national screening program for colorectal cancer for individuals over 50 years of age or those who are at high risk. Would also authorize state funding for these screenings and create a public awareness and education campaign on colorectal cancer. Despite scientific evidence supporting the benefits of screenings for these diseases in this country remains low. Every 5 seconds, someone who should be screened for colorectal cancer is not. When it's diagnosed late, the survival rate for colorectal cancer is only 10%. But when it's diagnosed early, before it spread, survival rate is 90%. Early detection screening saves lives, and everyone over 50 years of age, if they were screened regularly for colorectal cancer, the death rate for this disease could plummet by 80%. In addition to screening saving lives, early detection screening saves money. Treatment costs for colorectal cancer are extremely high and could be greatly reduced if mass screenings occur. Colorectal cancer treatment costs totaled roughly $8.4 billion for new cases in 2004. The cost of 2/3 of these colorectal cancer cases are borne by the Medicare program. The Lewin Group recently conducted a comprehensive study of the potential cost savings to Medicare and found that every 10 years, a colorectal cancer screening program will result in savings of about 1.5 years' worth of Medicare expenses. If screenings were increased among people 50 years and older in the United States, it would save billions of dollars in Medicare expenditures. It would also save thousands of lives. The Colorectal Cancer Prevention, Early Detection, and Screening ensures that people who are screened will get the full continuum of cancer care, including the appropriate follow-up for abnormal tests, diagnostic and therapeutic services, and treatment for detective cancers. If you have not already, I urge you to co-sponsor the Colorectal Cancer Prevention, Early Detection, and Treatment Act and join me in observing Colorectal Cancer Awareness Month. Observing Colorectal Cancer Awareness Month provides us with the opportunity to discuss the importance of early detection and screening. It also provides us with the opportunity to thank the thousands of volunteers and national and community organizations for their work in promoting awareness for colorectal cancer. Dan Boren, I thank you for your time, and I thank you for your work on this.
Thank you.